So good afternoon, everybody. Thank you, Dr. Karen. I'm Dr. Anuradha Pishmani. I'm the chair of the Education Committee of ASQua and OBGYN and Executive Director of Sriranga Hospital in Tamil Nadu in southern India. And in ISQua, I represent ISQua in various ways as a ISQua expert and ISQua tutor, and I represent in the councils of Person and Family Centered Advisory Council and Education Advisory Committee. And again, I represent the organization called CAHO, the Consortium of Accredited Healthcare Organizations, which work towards quality and accreditation across India. And through CAHO and ISQua, we have various partnerships where we do run monthly international webinar series with ISQua, and we have a Southeast Asian Fellowship program with ISQua now. And so coming to COVID-19, we have seen the whole fragility of healthcare systems being exposed throughout the world, which has already been overburdened and under-resourced. And India too had its own challenges. So the population, as you all know, it's 1.3 billion. I don't think so anyone would have faced this crisis with so huge population in the country. We were seeing what they have done in Italy and Israel in the morning session. But this is a huge population, and we had our own challenges. And India spends only 1.3% of its GDP on healthcare. And again, we have the double burden of both communicable and non-communicable diseases, again with low infrastructure in health. When we see the doctor-patient ratio, in India it's 0.7 per 1,000 patients, compared to US, which has 2.3 per 1,000. And the shortage is more in rural and semi-rural, semi-urban areas. And with this, COVID struck in March last year, in 2020. And this is the latest statistics with 44 million cases. Deaths were around 528,000, and recovery was around 44 million. India has its own unique challenges, which was very new to the world. In the first case, we saw that we didn't have any PPE kits because India was not manufacturing it at that point of time. And India upped up its whole production by around 150,000 PPE kits was being produced per day. It became the largest, second largest producer in the world. That's the way India started raising up to the challenges. And again, we had a huge amount of bed shortages, because as you know, you have so much of rural areas where already it's overburdened healthcare system. And so we had to find out innovative ways. And there was a complete lockdown. And so everything was immobile. The railways was sitting immobile. So the government decided that to use the 900 rail coaches. It was deployed for COVID-19 patients. They immediately converted into COVID isolation rooms with oxygen and other supplies. And in this way, we were able to manage the surge capacity for COVID. Again, we had this unique problem because of India saw the largest lockdown in the history of the whole world. So this lockdown is for 1.3 billion population. And it's a very difficult decision for any country to take, because that too with India, we have 22% of the population below the poverty line, 90% of the workforce in informal sector, and we have very poor housing conditions for many of the dwellers. And lockdown has its own benefits, so that you are able to prepare your healthcare system, you reduce the number of transmissions, and you are able to up your testing facilities, because it was very new in India, and so they had to do this lockdown. But we have more than 139 million migrant workers in India, and this became a unique problem because without any income, these migrant workers had food shortages, they had an uncertain future, we didn't know how long the lockdown was going to last, and they started going back to their villages. They started walking thousands of miles, and there was absolutely no transportation at that point of time. And this created huge problems for them. Many of them had difficulty because there was absolutely no food, and they lost their lives also. And immediately the government started taking steps to give them food, and NGO organization pitched in to provide the transportation and the food. And this was a new thing which India faced again. And all of us knew we had to go in for telehealth. And India came out with the telehealth regulations only in March 2020, as soon as the pandemic broke out. And we understood that virtual is for real now. We had to change all the way of training, audits, accreditations. Everything was onto virtual mode. And even in our small hospital, we started taking up telemedicine for our chronic condition patients like diabetes, hypertension, and all those patients took up telemedicine. And we had to innovate. We saw in the morning in the core production series that we have a spiral innovation where we innovate based on the challenges which we face. So we had to understand what are the challenges, go on with innovations. So there was a huge shortage of N95 masks, and hence in our hospital we created this UV ultraviolet irradiation box, where we found out how much of irradiation is required to reuse these masks. So we created this box with the help of IIT technicians who are engineers. And it was in March to April, we had to create it very fast. And then for the last 1.5 years, we have been using this UV radiation box where we can use it repeatedly. And this is low-cost innovation. And this helped us to tide over the crisis of shortage of N95 mask at that point of time. And we even got an award, national award from CAHO for this innovation. Again, most of the testing booths were again innovated so that there was a distance between the tester and the patient. These were the various testing booths which were innovated. Again, we had to up our negative pressure theaters. We came out with this negative pressure theater model in our own hospital, though it is a small hospital. We had a doffing area. We had to take care of the safety of our own employees, our staff, our doctors, our patients. And we had these type of intubation box, which created a barrier between the patient and the doctor. Because it's a huge population, we had to create all these intubation boxes. Again, this is a new crisis. This oxygen crisis, which came up during the COVID pandemic second wave. It was there in all the papers. But India had to face, because it was a unique problem, because the demand increased by tenfold rather than what was being produced. Because in India, more than 70% of oxygen which is being produced is being sent out to the industry rather than to the hospital, healthcare. And suddenly this demand increased, and we were producing most of these oxygen production was only in the eastern India. And so the whole thing has to be transported long distance. And due to the lockdown, we had various problems because of the oxygen crisis. And we saw huge queues for patient and attenders standing waiting for oxygen. All the hospitals were filled up. So this was a new crisis. And again, we have come out with various innovative methods, and then all the production had to be increased. The new distribution plants network also has been put up now. Every medical college in many of these southern states have come out with their own oxygen plants now. They're all oxygen self-sufficient. They are not depending on any oxygen cylinders now. Again, we started the world's largest vaccination drive. So the largest vaccination drive again started off in January 2021, and it was on a digital platform with CoWIN. And we founded this Covaxin, the indigenous vaccine, which was founded in July 2021. And we also exported it to 46 countries. And India had the lowest vaccine hesitancy. There was nearly 94% has at least got one dose. It is very difficult to vaccinate the whole population, but the community health workers, the doctors, the nurses have all pitched in to do this. And we need to appreciate everyone who has worked in this. There was so much of, we had to educate all these people to get on with the vaccine. And again, Dharavi. Dharavi is Asia's largest slum area. And this is one of the largest slums in the world. WHO has lauded the way the Dharavi, the model of Dharavi. They had the 4T model. Because in Dharavi, it's a huge, dense population. Many people share the same toilet. More than 10 people share the same toilet. And again, there's inadequate water supply. There is more of improper waste management. So when the COVID pandemic broke in Dharavi, everyone was, we were all apprehensive because it's a huge place. And it is very difficult to control because no one is allowed to enter. into Dharavi, and so they took up the help of all the ASHA workers. They are the accredited social health activists in India, and they helped, they went into the community, talked to the people, helped in this 40 model of tracing, testing, tracking, and treating the patients. And that's the way the number of deaths reduced immediately. The recovery rate was very high in Dharavi. And it was a multi-sectoral approach where bureaucrats, politicians, government and private doctors, the municipal corporation workers, communities, families, and individuals helped each other to control this pandemic. So as you all see, we have been going through various issues. We have seen the various structural inequalities and the disparities that exist in our society. And COVID-19 has exposed all this, be it economics or health. It has been a huge distribution of loss and suffering, which is not equal across the world. So from Detroit in US to Dharavi in India, the narrative is the same, but the way we have managed our challenges is different. But all of us have had great learnings from this pandemic, and this has brought a sense of solidarity across the world. And again, India is a very resilient civilization. We have faced many catastrophes across all these years. It's a very old civilization. We have seen plague, famine, drought, earthquakes, but as a civilization, we have been resilient. We have come together, and we have a great community network and relationship, which is the basic of Indian culture. And this cultural priority has helped us to do the support network. And even the economic crisis has we have come out of this economic crisis in a bigger way. So I think with a great hope, with all these people working together, the doctors, the healthcare workers, the politicians, the bureaucrats, all of us have come together, and we have shown to the world that we have been able to face this challenge, and we will be an exemplar in the world to have risen to the occasion with facing all the challenges of COVID-19 in a low-risk setting. Thank you.